minor B width, bone pattern. No grafting is needed before implants. And 4 implants are planned with 3-dimensional dental volumetric tomography on the square arch form, and bone-supported surgical guide is prepared with the help of a CAD/CAM. And the bone density, the color-coded, can be seen with this procedure. You see here, this blue means type 1 bone, light blue means type 2, green is type 3, and yellow is type 4 bone. As we see here, we have pretty much dense bone type here around the implants. Only in this implants with the yellow one, we have type 3 bone. So we put our surgical guide on the soft tissue to make the extension of the incision site, and the surgical guide fits precisely on the bone, and there's no, with the hand, you can place it with the hand and you don't need to screw it into the bone with extra pins, and the 4 implants are placed parallel, and healing caps are placed, and with the vacuum form template used for the bite registration and also for the same time for the impression. It's an open tray technique, and verification jig with pattern resin to evaluate the model accuracy before bar construction. And the model is corrected with removing this analog and putting it back according to the verification jig. And the crown height space is evaluated with the putty index. And this case is still under construction, so I'm sorry, I'm not going to show you the final position of the implant of the patient. So this is an 82-year-old patient, mandible with division C- height bone with square arch form, 4 implants with a splinted bar planned, and implant placement with 2-phase surgery after a healing period of 2 months. Transfer couplings are placed for impression, and impression with closed straight technique. And as usual, the bar does not fit. There's not a 100% bar fitting is achieved after casting. So we have to separate the bar and then use pattern resin to join the mouth and then solder it. And this is the final position of the bar, and the abutment margins are at the gingival level to allow evaluating the fitting accuracy of the bar. Impression and jaw registration at the same session, and the final position. As you see here at the PIP, the bar rotates a little bit anteriorly because the teeth are placed anterior to this bar position, which means a facial cantilever. We have cantilevers all around the mouth. If you move teeth more forward, then the amount of rotation will be much more, and there's a potential of hidden cantilever right here. And hygiene problem. The patient comes back, this is 1 year later, because of the manual dexterity of old people, the hygiene situation is not very good, and some gum problems here and recessions, and it's the final occlusion of the patient, the final views for implant mandibular or denture. A little slideshow of Istanbul. Thank you very much for your patience and attention.